Welcome back to Homeopathy at Home with Melissa. Hi, Melissa.
Hi, Bree. Great to see you tonight. Be here to talk about this fun, not so fun subject.
Yeah, tonight we're going to be talking, I say tonight, I do that all the time, the time of day that we're recording. We're going to be talking about ear issues. So ear infections, tinnitus, we even mentioned eczema on ears. So lots of different things that involve ears. And we'll go through some remedies, what those conditions are called, and hopefully give you guys some good information. But before we start, we wanted to read a review, just a little snippet. This woman says, this is Padma. So thank you, Padma, if you're listening, for leaving a review. Melissa, I came across your podcast recently, and your positive attitude gives real boost and motivates me to try homeopathic medicine.
Yay.
Wow, I can't believe I just totally butchered that.
Thank you, Padma. That's very, very sweet. And I love when people leave reviews because the encouragement helps me to keep going.
Yeah, it is really nice. We
it.
both actually said we went back and listened to one of our podcasts for the first time ever because we got such good feedback, and it really was encouraging to just be told that. So thank you guys for leaving reviews.
Yes.
To kick it off, I'm going to start by going over just the 3 sections of the ear. And then Melissa's going to get into a lot more details of conditions about the different types or different parts of the ear. So the ear has 3 sections. We have outer ear, and that's all of the parts of the ear that you can see and feel, which makes sense. Then we have the middle ear. And when people say they have an ear infection, that's most commonly what they mean, although not always. So that's inside the ear, not the part that you can see and touch. And then you have the inner ear, and that's deeper inside. That's where your balance comes from, where vertigo can stem from, and we'll get into all that. But that's deeper in the ear, and people do have issues with that, and those can be pretty severe. And I mean, this is me speaking from just experience. Those are typically longer lasting from what I've seen.
Yeah.
But not necessarily with homeopathy. So Melissa's going to get into different conditions that we deal with in different parts of the ear.
Yeah, thank you for kicking it off. So I'm going to start with the outer ear, which is the ear canal that leads down to the eardrum. And problems that you can experience with outer ear, one problem is too much earwax. And so I see that a lot. I hear a lot of people come and just say I have too much and overproduction of earwax. So too much earwax can cause problems with hearing. So you might sound muffled. Your ears might feel full. You might hear strange noises in your ears. And some people will use Q-tips, syringes, ear candles, warm oil, or even there's some kind of little vacuum, that people may either go to an ENT and have it vacuumed out or whatever and have it removed. And so in the repertory under earwax, there's a subrubric of is increased. And then there are various other subrubrics when you look it up. But listen, when you just remove the earwax, you're not taking care of the problem. The overproduction is a problem. So, any overproduction or underproduction needs to be uprooted with homeopathy. So you might consider Thuja. Thuja has an overproduction. And Thuja is part of the psychotic miasm. If you don't know what a miasm is, or you're interested in learning about miasms, I have a miasms course. Other remedies to consider are causticum and pulsatilla for this overproduction of earwax. And again, you're going to read them and see which one fits your picture the best. Silica and kalimira are cell salts that can be combined. You can take both of them together. And, I probably would take them twice a day for at least 8 weeks, because this is a chronic condition and it can help if you have too much earwax. So then there's the outer ear infection. So otitis externa is the medical term. And in the repertory under otitis, which is Latin for ear inflammation, you'll see some rubrics under there for outer ear infection. So often outer ear infections occur after swimming, especially when people swim in swimming pools that are not clean or as clean as they should be. Or maybe when people swim in dirty lakes and rivers, then they can get an outer ear infection. Or if children put objects in their ears, then that can cause an outer ear infection. If somebody has got eczema of the ear, then you would, of course, use remedies to address the chronic eczema, but they might have a flare up because sometimes eczema gets infected. And so we know we did an eczema podcast. So you can look back in previous episodes to listen to our eczema podcast. You can use remedies for infection, and sometimes it can affect the surface where you might get a little abscess or inflammation. And sometimes it can actually go right down into the ear canal. And it can be one of the most painful things. So you can use sepsis remedies. And at the time that when this infection is very acute, it can be red and throbbing. And so what is our red hot and high remedy? Belladonna. And so, you know, if it's red and throbbing, you'll think of belladonna. If you get in fast with some belladonna, then you might just abort the whole thing and, you know, not even have to deal with anything else of it. So you can do, you know, belladonna 30 or 200, and you can repeat it, you know, several times a day. If you need help with any kind of ear infections or trouble, I do acute consults, and that's on my website under the Make Appointment tab. So if the outer ear infection has been there a little longer, but it's still red and throbbing, then it may or may not have any pus. And the next remedy to consider is Hepar sulf. So Hepar sulf is a big remedy in inflammation, abscesses, and boils. And so we're told that Hepar sulf in a 30C potency will drain the pus from the boil. And it is said that Hepar sulf 200 causes the pus to be absorbed back into the body. That's also true with pyrogenium. I'm not saying that you should use pyrogenium right now in this instance. I'm just saying pyrogenium also, well, pyrogenium is a sepsis remedy. So when we were talking about using sepsis remedies, pyrogenium causes the pus to be reabsorbed. And then it's, again, like I said, it's thought that Hepar sulf 30 causes it to drain, 200 causes it to absorb. So if Hepar sulf is the right remedy, it will bring a lot of relief. So again, the Hepar sulf ear infection is red, extremely painful, and it may have started to perforate, but usually it's before perforation. So it's just really, really intense. And
I have a question for you.
Yeah.
Would you ever use Hepar sulf and belladonna together?
I don't think that I would. And again, it doesn't mean that they're dangerous. It's just not something I think to do.
Yeah,
So
like,
I think you
so
could. I think you
one
could.
should work. It's either belladonna will work great, and then if it
Because-
doesn't, move to Hepar sulf.
Because they're a lot alike.
Okay.
Hepar sulf and belladonna have a lot of the same quality. So I would say you could definitely choose one.
Yeah. Okay. I get the question a lot, or I have lately, with Hepar sulf being, in quotes, our homeopathic antibiotic. And we've talked about this in our class, that sometimes you use Hepar sulf on almost like twice a day while you're using other remedies. So I think sometimes people think that all the time you need Hepar sulf if you have an infection. So that's not always the case. I was just wanted to get that out there.
Yeah, that's a really great question. So, And I can see how when you present it that way, how maybe in my classes I have made people think that you have to have pepper sulf as a base, and then you use belladonna, silica, pulsatilla as your other remedies. You can do
Yeah.
it that way, but you don't have to.
Yeah.
That's a good way to look at it. So if you've tried those remedies that we just talked about, and you've given them a good amount of time, and there's maybe some of the extreme pain is gone, or but maybe some of the discharge is not gone, then consider silica, aka Cilicia. And especially if there's discharge, this can be less, silica is less intense, and there's usually silica is brought in at the end, like there's 10 to 20% left, so with or without discharge, it can come and finish up the job. So next is the middle ear. So that's otitis media. Everybody knows that word. That's what you hear the most often. And again, most ear problems are in the middle ear, and a lot of children have ear infections, and they're going to be in the middle ear, also called otitis media. So otitis media can lead to muffled hearing, and sometimes glue ear, which I'm going to go into in a few minutes if you've never heard that term. A lot of children will come with a history of repeated ear infections, often with very high temperatures. That was my son's story and my own story. Usually they've gotten lots of antibiotics, and the ear infection goes away and comes back. And so that's what they're told, and that's what they think, when really it's not. The ear infection never really went away. You suppressed the symptoms, you quieted those down, the ear infection's still there. And then as soon as you get off the antibiotics for any amount of time, then it comes back, because it's resurfacing. It never actually went away. They get more antibiotics, and you keep doing this cycle. And this is exactly what happened to me when I was a kid, and what happened with my oldest son when he was a toddler. Lots of antibiotics, and then of course what happens? Your gut health is destroyed after so many antibiotics. So the middle ear consists of the eardrum and 3 tiny bones which vibrate. 2 tubes lead off from there. So the eustachian tube goes to the nose and the throat, and that's why there can often be throat infections and sore throats with an earache or ear infection. The eustachian tube is an air-filled cavity which keeps the pressure balanced between the air inside and outside the ear. Also the eardrum, all part of the same system. So if it's unbalanced, then the eardrum won't vibrate properly, and then there's hearing loss. And it's very common, especially in children, because their tubes are so narrow, and they get a lot of mucus and drainage in the eustachian tube, and then they get the blocked hearing, so they can't hear as well. So my oldest son had tons of ear infections, and he was delayed in speech, and I was really worried about him. And the pediatrician, explained to me, he's had all these ear infections. First of all, he probably hasn't been able to hear well for the first 2 years of his life. On top of that, while you're always sick and trying to heal, you're not developing in other places. So of course, and then the pediatrician also encouraged me in that same visit, Melissa, he's not going to go to college not talking. He's fine. So, and he absolutely is fine. And, it wasn't a big deal, but those 2 explanations really helped me to feel better. I was really worried about him. So with ear infections, we need to differentiate between several infections. So with high temperatures sometimes, and extreme excruciating pain, and milder infections described as an earache, or the child's just holding the ear. An earache, as opposed to an extreme ear infection, can be the result of too much mucus, just narrow tubes. And, an earache can follow or go along with a cold. And for some children, every cold seems to go to the ear, but it might be mild, it might be achy, they might just be holding it. So your doctor will use an otoscope, which is an instrument to look inside the ears. And what I often hear that the doctor sees is a bulging eardrum that's full. They might look in there and see that it's red, which is when it's extreme, or that it's pink and that's when it's not so extreme. A bulging eardrum can burst. And the minute the eardrum bursts, the pain goes and there's relief, and then there'll be discharge because then it drains. So the eardrum really is this really thin, it's like a grayish, it's really thin, whatever it's made out of. And the mucus pushes on it and makes it bulge, and then it bursts. And then the drainage goes through and it drains, and then the pain is gone. And so unfortunately, doctors get super upset and worried about a burst eardrum, when actually most of the time you're on your way to recovery when it bursts. So then the drainage comes out. That eardrum, usually, and especially with homeopathy and good diet, can heal. Our bodies were made to heal. My oldest son had a burst eardrum. He does not have any hearing loss or hearing problems from that. But that's, I think also doctors worry that there could be some hearing loss if the eardrum bursts, and maybe that does happen sometimes. So remedies for extreme ear infections are belladonna. And just remember your keynotes for belladonna: red hot high, sudden onset. This can be brought on by water, like swimming or taking a bath or a shower. So like you're washing your hair and the water's going in it. The cheeks might be red. Of course, the high part, the red hot high means a high fever, delirious, cold feet. If they're old enough, they'll tell you that it's throbbing pain, but most children that get these kind of ear infections don't know to say throbbing, but belladonna has that throbbing, and it can be worse 3 a.m. and 3 p.m. Chamomilla is a big remedy for earaches because of the pain. Chamomilla has a great deal of pain. It's extreme pain. And you look at the temperament of chamomilla. So remember, you want to spank a chamomilla, you want to hug a pulsatilla. It's that temperament. So you might just have one red cheek with chamomilla, but sometimes they can have 2 red cheeks. They might also be teething at the same time, or this earache might be due to the teething. They're usually worse around 9 p.m. They go to bed happy, then wake up between 9 and midnight screaming. And then often that will indicate chamomilla. And also chamomilla is number 1 for a burst eardrum. And they sleep after they get the chamomilla, and they wake up and there's some yellow discharge on the pillow. So the eardrum is burst, the drainage has come out, and they feel a lot better. Aconite is another big one. It's a sudden onset. Aconite can have fevers, ear infections. Remember, aconite: first, fast, fear, fright, fever, frozen, flu. And a rhyme that I made up was first, fast, fear, fright. That's when we call on aconite. And so it could have come on after a shock. So this earache could have come on after a shock, a shocking situation, a fright, a cold wind. They're usually worse at midnight, and they may or may not be restless with anxiety. And then the ear might be red and hot. I love the ABC combo. So ABC, aconite, belladonna, chamomilla. And so you want to have this combo ready, 30C in each of them. That's for that extreme pain in the middle of the night when the child is screaming. It could be during the day too, but usually just, that extreme pain happens at night. Mm-hmm. So pulsatilla is an excellent remedy for earaches and ear infections. So remember, you want to spank a chamomilla, you want to hug a pulsatilla. So you see this puppy dog eyes, pitiful. She wants to be held. And when you hold her, she just feels so much better. So this is the pink ear, right? The pink eardrum rather than the red bulging eardrum. So that red bulging extreme pain is belladonna, chamomilla. This more mild pain is pulsatilla. And so the ear is hurt, it's uncomfortable. The child might be weepy, clingy, whiny. They're better in the fresh air, so they might want to be outside or have a wind. They like the wind. They might want the window open or a fan blowing on them. And they often get an earache with every cold. Another great remedy is Ferrum Phos. So as this is Ferrum Phos symptoms are more mild, the most mild symptoms of everything. So it doesn't have a fast onset like aconite, belladonna, and chamomilla, but you can give it at the beginning. So as soon as you feel something coming on, Ferrum Phos is a great first remedy to give. Pepper sulph, we kind of talked about already. It's very painful. The person might also be very irritable, oversensitive, better for warmth. So they might want something warm on the ear, or they might want to be bundled up because they don't want to be cold. And another great remedy that I really love is mercury or mercurius. So Mercaviv or Mercsol, Sin. And so mercury is really a toxic state. And so this person or child might just have an ear infection all by itself with no other symptoms. And this can be a really intense ear infection and have some discharge. So there could be some blood in the discharge, and it could be very smelly. So mercury often has symptoms that go along with this ear infection are high fever, sweats, swollen glands, and swollen tonsils. Mag Phos is another good one. It's better for heat. You can, this can also be a very sudden pain. I love Mag Phos. A few more remedies are calc sulph, silica, and calendula. So calc sulph is a great remedy when you have pus and you've got a hole because the eardrum has burst, the discharge is flowing out, and it continues to flow out. It just keeps coming. So you can give this for, 5 days or more to see if you can completely clear up the discharge. The discharge might be thick, creamy, and calc sulph is a great remedy for that. Silica is the thin, smelly discharge. Or you've tried calc sulph and it changed to thin and smelly, right? Calendula is fantastic to help with the perforated eardrum. So you can use that in not the herbal tincture. I mean, I know some people like to put things in the ear. I am not telling you to do that. Do that if you want to, or if you like to, or whatever, if you know about that. I'm telling you, take calendula in potency by mouth, 200C, 30C, 6C, any of those should be fine. One of the things that can happen if a child gets middle ear infections is they have some temporary deafness. So there are rubrics in your repertory under ears and hearing. And so there'll be catarrh of the eustachian tube, and that might cause the temporary deafness. There's a rubric called impaired hearing, and there's one called deafness, eustachian, and catarrhal, and under that rubric is pulsatilla and Kali-Mur, and you can read about those. So glue ear is an accumulation of sticky fluid behind the eardrum that leads to temporary deafness, hard of hearing. With glue ear, they might not have the catarrh anywhere else, so they might not have the mucus anywhere else. It's really specifically in the eardrum, and they can have had this for several months or even several years. And so a few children are even born with it these days. And some children can seem to have glue ear and they've never had an ear infection. So this is in the middle ear, and it's the eardrum that we're talking about. So what do doctors do about glue ear? Well, I think beginning about 20 to 30 years ago, they, if a child had glue ear, they would do lots of rounds of antibiotics. So just like with the regular ear infection, antibiotic. After a certain amount of time, I don't know what that is, they decide they're going to put tubes in the ears. So they get these T-shaped tubes, and they actually work because the pus and the discharge can drain out, right? So it keeps that drainage going. So then their hearing is open and they don't have any pain. But the problem is that the tubes fall out sometimes too soon. And then either when the tubes fall out, even if it's too soon, or when they're supposed to fall out, you didn't take care of the problem. The problem is an overproduction of mucus. So you didn't fix that. Homeopathy can fix that, right? So that's just like the tubes is like a Band-Aid. It helps, but it doesn't fix the problem. So you might consider a cranial osteopath. They can really help glue ear. A chiropractor. You might consider going dairy-free while you are healing this. Not that going dairy-free is going to it's not going to uproot the problem or fix the problem of too much mucus, but we know that dairy, even raw dairy, can cause your body to produce more mucus. So while you're dealing with too much mucus, maybe cut dairy out for a short amount of time until you heal, and then you can reintroduce it. You can also massage behind the ears, which can be very useful to help that drainage. And then there's a rubric for glue ear, and that rubric includes Calimere and Chamomilla, and probably some others, so you can look that up in your repertory. Glue ear is always going to be constitutional, and acute. So it's constitutional and acute. So often you're going to need to use constitutional remedies and miasmatic remedies. So you need to pin down what miasm are we looking at here, and use the miasmatic remedy in the correct timing. And also then treat, help give remedies for the specific thing, for the drainage and everything that we just talked about. So if you use the miasmatic approach, you're going to do that when somebody's got a history of a lot of ear infections, or a family history. So parents have lots of ear infections, right? So Chandler, or my oldest son, had lots of ear infections, and so did I. So that's a miasmatic, right? That's passing it down to the next. So if he has children and they have lots of ear infections, we know really quickly that we're gonna use the miasm approach to help. So very commonly, you're going to use tuberculinum when there's a miasm there, especially if they've had frequent ear infections with high fevers. Metarhinum is used when there's lots of thick mucus, and the bowel nosodes can be really useful. So that was a lot of great information, Bree. I'm going to voice rest and let you do the inner ear.
Okay, but I have to ask a question real quick.
Okay.
Of course. For bowel nosodes, you would obviously get a full picture. So those would be something you'd go to if there were other symptoms also?
That's right. Yeah. Yes. And the one that just comes to my mind right off the top is Morgenbach, because Morgenbach, and that, I'm not saying this is the one that you should use. I'm saying go read it, go read all of them. But Morgenbach has a lot of congestion. Congestion is a keynote of Morgenbach.
Okay.
So congestion anywhere in the body, but also the person doesn't like congested areas. They don't want to be in crowds. Congestion is a big keynote.
Okay, thank you. Okay, so I'm going to go over the inner ear, and the medical term is otitis interna. So this is deep in the ear. This can sometimes be referred to as the labyrinth, and contains the nerve endings responsible for detecting sounds. So in there are fluid-filled canals, which are the organ of balance. So if this becomes out of balance, there can be pretty severe effects. So there's dizziness, vertigo, even severe enough that you're falling. This might be caused by a virus spreading up from the eustachian tube. There may be nausea and vomiting that accompany the dizziness and vertigo, and can also include Meniere's disease. So that can lead to more extreme and a more permanent version of labyrinthitis, which is a new term for me. So this actually in the repertory, which I thought is crazy, also is very helpful, because as you know, if you've used a repertory, half the time we don't know how to look words up because I would never in my whole life thought of labyrinthitis to look up an inner ear
Yeah.
infection. So write that one down somewhere so you know how to find it. Some good remedies for labyrinthitis are phosphorus. Phosphorus is great when there's vertigo. That's worse for looking down. And all of these remedies have more keynotes, more information in your Materia Medica. Gelsemium has dizziness. The 4 Ds of gelsemium, Melissa always says: dizzy, drowsy, droopy, dull. So you have dizziness. You may be weak and trembly. Belladonna also is a great one for this also. With dizziness, that's worse with sudden movement. Conium is a great remedy. That's a part of the Banerjee protocol that we'll get to for vertigo. And cocculus. Cocculus indicus is amazing for vertigo, dizziness, almost always has nausea. It can be great for jet lag, or maybe you had a problem because of jet lag, worse when you're traveling. This may be worse sitting up and better for lying down. So I mentioned Meniere's disease before. That is a buildup of fluid in the inner ear chambers. And this can be very chronic. So it can last months, even years. It can recur. Sometimes it can lead to tinnitus, which is noise in the ear. And that, I didn't know this, so maybe this is just common knowledge. I didn't realize how varied that could sound. Like the tinnitus noises can be whooshing or water in the ears to ringing. And I didn't know all that until you start getting into repertorizing and hearing people's stories.
Yep.
So just consider that if you have weird noises, it doesn't have to just be ringing.
Mm-hmm.
So for Meniere's, we have cocculus and phosphorus again are great remedies for that, but also China sulph and salicylic acid, which is from willow bark. And willow bark is what aspirin is synthesized from. Thought that was a cool little tidbit.
That is cool.
So for tinnitus, because that's caused in the inner ear, stems from the inner ear, argent nitricum is a great remedy for vertigo with tinnitus. The Banerjee protocol for tinnitus is tellurium metallicum, 200C every 3 days, and conium max 6C twice a week. So, man, you need your calendar for that one. Every 3 days and then twice a week.
So I often just combine the two because really every 3 days is twice a week.
I know. You know what? One time I did calendar out. What would it be? Twice a week is what, like 8 times a month, every 3 days, let's say is a 30-day month, is 10 times. It's not a big enough difference because I would never keep track of every 3 days.
No, yeah, I just combine them.
Yeah. Okay, good to know. Like combined meaning at the same time in your mouth?
Yep, taking it at the same time. Yep, twice a week. Mm-hmm.
That is really good to know. And also just know the Banerjees use the 200 and 3C potencies, but those can sometimes be hard. Well, 3C can sometimes be hard to find. So there are times people have used 30C, 6X, or 6C. So just don't get too stuck on potency. We talk about that. If it's a chronic issue, maybe be more careful about what you order. But
yeah.
Okay. Another interesting thing is we found that one source of vertigo and tinnitus is mold. And treating the mold, you can treat the mold, that problem, so mold in the inner ear. Is that what that is saying, if I'm reading it correctly?
Let me go look at it. Let's see.
It's actually like a mold buildup in your body.
Treat them on I know.
Exposed to mold?
No, yeah, I read it as just being exposed to mold.
Okay, that makes more sense to me, but I learned stuff. I mean, I've already learned like 3 things just from this podcast, so didn't know if it could actually happen. So if you have been exposed to mold, that makes a lot more sense that you can use for mold. It's not really mold detox, but you can consider it that. you can use Thuya 30C and or Calimere 6X together with Nat Sulf 6X. And that works very well. You can use those Calimere Nat Sulf throughout the day in a water bottle to make it really easy. And the Thuya 30C, what, once a day? What'd you say for Thuya?
Say that again.
Would you do Thuya 30 once a day?
I
And
would.
the cell salts a few times a day, or pick one and see how it goes?
Yeah, I would do. I really love Thuya for that, and so I would do Thuya. Let me see where you are. Okay, so Thuya 30C. Yeah, and I would probably also do the cells. One, I would probably choose one of the cell salts. But you could do both. So basically what it says is Thuya 30C, Calimere 6X, and Nat Sulf 6X that people have been using. So I would say you could do all three.
And I've read a couple places where they do put those in water, Nat Sulf and Calimere together in water, and then take Thuya separate, and it works really well.
Yeah.
And then the Banerjee second line protocol. So we had the Banerjee first line, threw in that mold situation there, and then we have the Banerjee second line is Hyoscyamus 200C twice a week and Coniamac 3C twice a day.
Yeah.
And so that means if you tried the first line protocol for tinnitus for 8 weeks and saw no change, then you can move to second line. Or if you know it was mold, maybe try the mold protocol.
Yeah. Well, and so with tinnitus, what I've seen so far is when you've had it for many years, 10, 15 years, I haven't yet seen homeopathy do too much with it. But when somebody comes to me and says, I am just now starting to have ringing in my ears, when we jump on it like that, I usually will see. Of course, nothing's 100%, but I do see homeopathy work better when we get on it fast.
Yeah. Yeah. I would agree with, I haven't seen it as long, but it is when people have had it for 15 to 20 years or such a long time. Which I can't imagine, by the way, that would drive me nuts. They just really get used to it. They're like, I can't do anything about it. It's just there.
So I have tinnitus, and I have for about 15 years. And so many people say it literally, like it does drive some people crazy to where, I mean, people can get like suicidal because it drives them crazy. It doesn't bother me. What bothers me is that I can't hear. Because the ring keeps getting louder and louder. It's slowly, very slowly over the years. So as it gets louder, I can't hear. So that's what bothers me, is that I'm like, say that again. What'd you say?
So, you know what, typical homeopath situation where we don't treat ourselves. Have you done any of the protocols for yourself?
Well, I did try the protocol, and I was one of the ones that I've seen out of the many people that I've tried to help. After it's so old, it doesn't help. But back when this started, I was very classical, so I was just one remedy and wait along, and I was really working on my hormones back then. So
yeah,
do anything with it.
Well, there's still time. We'll see.
Yeah.
Thank you guys so much for joining us for this podcast. Hope you learned something. I learned a few things. So hopefully that's useful to you. Thank you, Melissa.
Yeah. Thanks for being here with me, Bree, and we'll see you guys next time.